oncology nursing because I love to work with the patients that I care for. They are very strong and persevering people, and I feel it's an honor to be with them at this time in their life.
I chose oncology nursing because my sister passed away of colon cancer when I was in nursing school. And I love oncology nursing. My patients, I get to take care of patients from every age span, and I get to be with them and take care of them, and they're just loving people. And I just love my job.
Hi, I'm Maria. I work at Mather. I love oncology nursing because I love taking care of the patients. They're not, even though they're very sick, they appreciate everything. And that's about it. I love oncology nursing.
I'm Caitlin Eleuterio, and I'm one of the staff nurses on the floor. And I enjoy being an oncology nurse because, to me, I find it very rewarding. If I can help my patients with any little ease of their pain, their nausea, get them any little thing, or help them with their diagnosis, talk to the families, I find that rewarding to me. And if I can help them in any way, that's why I love being in oncology.
Hi, my name is Jessie, and I've been working in oncology for about 7 years. I enjoy oncology nursing because the emotional bond and attachment that you have with your patients is something you can't put into words. And to know that you can be a part of the most stressful thing that a person has to go through with them and their families is the most rewarding thing that I can possibly do in my career. It makes me happy to be working in oncology.
The reason I wanted to say something about oncology nursing is that for the past year I've been working with a group of women that face obstacles every single day that they have to overcome to care for their patients. I've adopted a little bee to represent us oncology nurses. The bee itself also has to work 24/7 with a group of other bees to get the job done. They have been given a body that's way too big to fly in spite of its tiny wings, but it flew anyway. And this is what I see the nurses up here doing with our patients. They're constantly educating themselves and finding new ways to care for their families and patients and treating them well even when the outcome isn't.
Hi, my name's Nancy Robb, and I've been an oncology nurse for 24 years. Oncology patients and their families are facing one of the gravest things that someone can go through in their lifetime. The challenges that they have are very difficult. If I can help them in any way to work through that, then I will still continue to be an oncology nurse.
I just love my patients. I'm just going to give you an example of one day I walked into my patient's room, and it was around October, and I was dressed up, of course, because that's what I do for my patients. And the patient looked at me and she said to me, "Why are you dressed like that?" And I looked at her and I says, "I wished I had a mirror, because if I had a mirror, when I first walked in here, I said, saw a smile go across your face. It's the most beautiful smile I ever saw." And she says, "Did I smile?" And I said, "Yeah, you smiled. I wished I had that mirror." And we just became the best of friends. And it was all, you know, oncology is a hard floor to work on, but it's just the rewards that you get. You get so much back from your patients.
Hi, I love oncology nursing because of the patients and their families. We develop very good relationships on this unit that I would not have on any other floor. My patients are very appreciative of life. They've taught me to not sweat the small stuff, to just appreciate every day that you have, because you never know what may be coming around the corner. So that's why I became an oncology nurse.
I became an oncology nurse because it was the only position that was available when I applied to nursing, and I love it. There was a reason why God chose this for me, and I have the greatest satisfaction in being an oncology nurse. I go home every day feeling like I made a difference in somebody's life.
Oncology nursing requires a special presence because we care not only for our patients' physical needs, but we care for their emotional and their spiritual needs. We join ONS in celebrating Oncology Nursing Month, exceptional nurses giving extraordinary care.